Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Hello, Leslie. We get to have you back on the show again today.
Yes, thank you so much.
Joe is actually in France on a girls only trip. So we get to discuss Medicare. Some Medicare news actually that came out in the last few weeks. You and I were talking about it. Yeah. And we got to introduce to Brandon, who I'll introduce you guys in a second. And so we felt like this was probably a really good time, given all the news that's come out, to have somebody else, a broker who actually understands these things far more than I do, at least on the details of things. We obviously talk about it from the provider's perspective. Right. But there's other things that I was talking with Brandon in the last few days. I'm like, holy smokes, I had no idea. We need to have you on the show so we can discuss these things. So Brandon, welcome.
Yeah, thank you very much, Brian.
So give us a little background. I know Medicare and insurance was not what you went to school for. You were a mechanical engineer before, and then this was kind of a family business that you kind of fell into. Is that right?
Yeah, that's pretty much exactly what happened. So I first got my taste of the insurance world. It was about 2018, 19-ish. I was trying to find a summer internship. I was going to school for mechanical engineering. I could not find a job anywhere. COVID was rearing its head, just starting. And so I did everything short of going to work in a warehouse. And my uncle finally said, hey, just come work for me. We'll get you licensed to sell property and casualty insurance. I was like, all right, great. Office job, air conditioning, count me in. So I made a living cold calling plumbers, selling them general liability policies. And I continued to do so until I finished my degree December of 2020. Short time after that, I found a job working as a structural engineering intern, basically, for a foundation repair company, doing foundation assessments, repair plans, things like that. I liked what I did. It wasn't exactly what I was studying, but I very quickly realized that corporate America was not for me. I needed to work for myself. So very thankful I called my uncle back and he said, yeah, just come on and come work for me again. And so that was July 1st of 2022. We decided to dive into the Medicare space, then kind of transition away from property and casualty. So I've been doing this since July 1st, 2002. I generally specialize in doing an educational event in which we invite people turning 65 to a Medicare workshop is what we call them. Mm-hmm. We give them information about the original Medicare, supplements, Advantage plans, what you need to do, what you need to look out for, things like that. Fast forward to December of last year, we ended up selling the property and casualty book of business and diving headfirst into Medicare. And that's when we decided to bring Ryan on. So Ryan, who trained me in all of the property and casualty world, I'm now training him in the Medicare world. Yeah. So a little bit of a circle there. So we've, again, doing that ever since. Okay. So long story short is that I went to school for engineering and here I am hosting Medicare
What
workshops.
I like about it though, and the reason I brought up the mechanical engineering thing is typically engineers, because I have engineers in my family, you guys are very like left brain, logical. Oh yes. Like there's an analytical side to it versus, hey, I'm out here to sell you something, which you and I talked before. Yeah. Like that's one of my pet peeves about the insurance industry is that it feels like it's a lot of times, there's a reason why the incentives are the way they are, because they're trying to create an outcome. The insurance companies are wanting to create an outcome that they find more profitable for them. Right. And so I like when I get to meet people who are much more analytical, logical. It's like, hey, there are times and scenarios where one may fit you better than the other. So going along with that, I know there's a lot of. We talked before. I admire the creativity, but I think sometimes the fact that there's so many variables within these insurance plans, I kind of feel like it's a little bit of a intentional thing to create some confusion. And the seniors who are 85 are just like, I don't know, just tell me what I need to sign up for. So I'm a little annoyed by that, but there's lots of options though too. And so there's a couple options I had no idea about until just recently. But in general, can you kind of describe what the Medicare policies look like from original Medicare to supplements to the Advantage plans?
Yeah, absolutely. Yeah. Kind of going back with what you said, it's confusing, right? Yeah. We have a saying as agents, it's 80% of seniors who are turning 65 are confused by Medicare. That just tells us as agents that 20% of people are liars. That is because Medicare is a very confusing topic. There's lots of red tape. It's federal, it's state level, it's private insurance, it's not private insurance. So a lot of times you don't know which way's up. To start with, original Medicare has been around since 1965. This is the Medicare that people's parents have had and people's grandparents have had. And the Advantage plans really came into the market. I believe the first ones came around in 97. They've been revised several times. They really started to gain a lot of traction in about 2006.
Yep.
So original Medicare is provided by the federal government. It is original Medicare Part A, which is going to cover your hospitalization stays. It's going to be original Medicare Part B. It's going to be your doctor's coverage. Part A is going to be free for a lot of people. When I say free, nothing's really free, right? It's Medicare sees that if you have paid in 40 years of FICA taxes, you've essentially paid your Part A premiums already. You no longer owe that. Part B is not free. It does have a variable monthly premium that is large in part due or based on your 2 years ago adjusted gross income. So for the base premium for Part B this year, $185 goes up with the income from 2 years ago. It's always adjusted. Advantage plans are going to be not income driven. The plan is the plan, whether you are a millionaire or whether you are not a millionaire. They are going to be held by private insurance companies, and Medicare Advantage plans are a way to essentially privatize your Medicare coverage. They are Part C Medicare Advantage plans. It's because they are subsidized by Medicare. Medicare agreed to pay each participating insurance company approximately $1,000 per person per month, $12,000 a year, if they get someone to enroll in their Advantage plan. Once you enroll into an Advantage plan, original Medicare basically wipes their hands of you. You are now a client of XYZ company's Advantage plan. You are paying their copays.
That is probably, I know Leslie deals with this too, Medicare. As a case manager, that is probably the number one most misunderstood concept, if you will, about Medicare and Medicare Advantage is they'll call and say, hey, I'm sending my mom. We heard about you guys. We love y'all. We're going to send our mom to you. We say, great. What insurance does she have? After we find out what's going on with her, we'll find out like, hey, can we even work with you? Because are we in network or not? And they'll go 9 times out of 10. Oh, mom's got Medicare. Awesome. Makes it easy. And then we get her insurance card and it's United Healthcare or whoever else. And we call them back like, yeah, actually we're out of network for that plan. And then she'll say, but I was told my mom has original Medicare. Like she has Medicare. Like you guys are in network with Medicare.
Or with a supplement.
Yeah, with a they believe it's a supplement, not a Medicare Advantage. And so I'm glad you brought that up. It's when you go from original Medicare to Medicare Advantage plan, you are no longer, even though it says Medicare in Medicare Advantage, you are no longer being covered under Medicare. Your dollars that Medicare was holding for you that you spent, your FICA taxes into are now being transitioned or shuttled over to UHC, Aetna, Humana, or whoever else you chose. And they are now in charge of directing your care.
Yep, that's exactly right.
And paying for your care. Yeah.
Yep. And those Advantage plans are going to be HMOs, PPOs. You're going to have some private fee for service.
Yeah.
Whereas original Medicare, there's not really a doctor network per se. It's
all a PPO.
Yeah. It's do you take Medicare? Yeah. And if the answer is yes, they're going to take Medicare. They're going to take the supplement. Yeah. Not the case with the Advantage plans.
Yeah. Okay. And then so the other benefit of the Advantage plan though is my understanding is if you go to Advantage plan, you don't have to get a supplemental, like a D plan, like a drug plan, right? Because it's kind of wrapped up into.
Most cases, yes.
Okay.
Most of the Advantage plans you see out there in market, they are actually called Medicare Advantage prescription drug plans. They have drug coverage included in them. Yeah. You really kind of have to search for those that don't have drug coverage. And realistically, the only reason why you would do that is if you are a qualified veteran, you're going to use the VA to pick up all of your medications, things like that. So there are Advantage plans out there without drug coverage. The majority of them, that the common ones out there, have that drug coverage.
Okay, gotcha. And so they have an option of HMO, PPO, fee for service. I don't know if that's what you said. Yep. And so what are some of the trade-offs that you see? Like when you're educating your clientele, family members, the 80-year-old seniors themselves, what are the things you say, hey, here's kind of the top options we can look at, including original with the supplement. Here's a couple PPO, HMO plans, whatever. When you're going through, hey, this is what you're looking at. These are options. What kind of trade-offs are you highlighting for them?
Yeah, so the main trade-off is if you are going to remain on original Medicare, and for sake of conversation, I'm going to assume that whenever we say original Medicare, you're pairing it with a supplement.
Yes.
It's very rare.
Why is that? And so tell the audience, why is that necessary?
So it's not necessary, but it is a fantastic way to minimize your exposure because original Medicare while it is widely accepted, it can get expensive. Yes. It has some very high copays, and there is no maximum out of pocket.
Right. That's the key, right? So it's that they will cover like an 80%.
Yeah, they cover everything.
The other
80%.
20% is on you.
Yep.
And there's no limit.
Nope.
So you're going naked. If you go back to original Medicare, like you are susceptible to any number of huge hospital bills, that 20%.
Yep. Yeah. Well, so the hospital is going to be covered under Part A. That's going to be a flat per day copay. Part B is going to be your physicians, your specialists, things like that. That's going to be your 20% co-insurance.
Okay.
Either way, it can get very expensive with no max out of pocket. If you want to look through a silver lining of an Advantage plan, it's that it has a max out of pocket. HMOs are going to be lower than your PPOs. Those Advantage plans, they're also going to lump in your dental, your vision, your hearing, your drug coverage. They're going to have extra incentives, the fitness club program, over-the-counter credit, great. And it all wraps everything up in one simple card.
Right.
You go to your doctor, you give that card. You pick up your medicine, you give that card. The converse is that you are dealing with doctor networks, so it's harder to get service. And then you guys obviously see the backside of the claim denials that are on those Advantage plans. If you're going to hammer home the benefits of original Medicare, it's that you have a much more wide variety of doctors to choose from, whether that's here in the Metroplex, whether it's nationally. You go see any doctor across the nation that accepts Medicare, you're going to have coverage on that supplement.
Yep.
With those supplements, there's going to be a monthly premium, and this is generally why people kind of balk at the thought of a supplement. You're already paying $185 a month for your Part B, then you have to pay X amount over that for your supplement, and the supplements are going to range. I have a couple of printouts here, just a rough general $130, $140 for a male for a Plan G. So that's on top of your $185 for Part B. You start adding it up, you creep into the $300 figure. Then you got to talk about your drug coverage. Yep. Medicare also doesn't cover dental, vision, hearing. You have to talk about dental, vision, hearing. So if you wanted to go everything out, you're creeping up to about $400 a month. It's going to be some fantastic coverage. You're going to have basically your max out of pocket is going to be your Part B deductible in most cases. Whereas on the Advantage plans, in a vacuum, month to month, you're paying $185 to be enrolled in Part B. And then if your Advantage plan has a monthly premium, you're paying that month to month. It's going to be a lot less expensive. However, nothing's free, right?
Right.
There's those trade-offs. In change of, maybe $0 up front per month, you're going to have copays on the back end, whether you're going to the hospital, whether you are going to an emergency room, if you need an MRI, a specialist visit, things like that. So in a vacuum, month to month, you're not using your plans. You're going to be better off saving money-wise on the Advantage plan, but it's whenever you need that coverage, you have something that needs to be taken care of. Well, you could very likely find yourself coming out ahead of the game with a supplement and an original Medicare as opposed to your Advantage plan, which doesn't cost you anything per month. But
that's right. We have seen that regularly. Now, granted, in to be fair, I try to be fair. I'm obviously biased because I get to see it from the provider side of it. But to be fair, the people that we get to work with are usually more frail elderly, right? So there's already multiple comorbidities that we're working with. We're not seeing people like in an outpatient like fitness center, right? So I want to be fair and go like, what we get to see is obviously we are, it's far, far easier to work with Medicare. And when we are working with the Medicare Advantage plans, we hear horror stories regularly about, the SNF, the skilled nursing facility, or the rehab hospital that would not accept, that they couldn't get approval for. We've had several clients of ours where they've been in a skilled nursing facility and they were only authorized so many days. A recent story from this past year, we had a lady who lived north of here, was in a skilled nursing facility. The insurance company authorized only so many days, but she'd had a hip fracture and she knew she could not go home on her own because she was still non-ambulatory on that hip fracture. And so she ended up having to cash pay for 2 months extra in a skilled nursing facility. Her bill was something like $25,000. And so you do the math on that. I mean, that would pay for the next like 10 years on original Medicare with a supplement just because she had that one. So sometimes it works out really heavily not in your favor if something catastrophic like that happens. So we get to see that again, because we're dealing with older, more frail people. We're
65-year-olds.
We're seeing I'm not seeing the 65-year-old golfer unless they're going to go see one of our doctor buds who do like knee replacements.
Right.
We'll see them for a couple of weeks and then they're off, doing their thing. But most of our patients is they are weaker, they are more frail. And so we get to see the downsides of when you do tip from being healthy and active to now I'm starting to need more care. That's where we really see the challenge.
And you really don't see that coming.
Correct. It's like one thing and it's like
everyone's
boom,
healthy, and then all of a sudden,
right.
Now I'm sick and needing the hospital, and emergencies are emergencies for a reason.
Yeah. Right.
But can't you just switch back to original Medicare once you have Advantage plans?
Yeah, that's oftentimes. So this is the other thing.
Yeah.
So I never studied these things until I saw these things with my own eyes on patients I was working with. I didn't understand like why this was happening. Yeah. So I remember a few years ago trying to help. There's a guy who I'd previously worked with like the previous year, and I don't remember the whole scenario, but I worked with him, so they knew me. And then the following year, he calls me up and he's like, "Hey, I need your help again. I was recently in the hospital for X, Y, or Z." And so I was like, "Sure." I said, "Just have the case manager send the orders and your insurance information, and we'll run benefits, whatever." And he has changed from original Medicare to a Medicare Advantage plan. So I scratched it. It's probably 2 years. There's like a gap year, and so he was now on a Medicare Advantage plan. And so he's like, "I never intended to switch." And I was like, "Well, this is what they have you on now." I said, "So you can call and try to see if you can switch back." I didn't know any better that you couldn't, because now we're past that 1 year point. Okay. So I get on the phone. He gets on the phone. He's like, "They're telling me I can't switch back." And I'm like, "That makes no sense. What do you mean you can't switch back?" This was my naivety. And so I actually called. I went over to his house, called with him, because they won't talk to you. I'm a provider. They will not talk to you about a member's benefits unless I'm calling from my office. But like when we were calling and starting to inquire, like, "How do we get you switched back?" And so I remember clearly it was Mutual Omaha. And I used the term, you haven't been around long enough, but I have been around for a while. And they used to not be called Medicare Advantage plans. Do you know what they used to be called?
Medipack?
No, Medicare replacement plans.
Oh, okay.
When they first started, they were called Medicare replacement plans. They couldn't sell them. Why? Because ain't nobody want their Medicare replaced. I spent 40 years paying into this thing. You're not replacing my Medicare. So I used that term with this lady. And so this rep on the phone, and I was like, "Hey, here I'm with Mr. Jones." And I said, and I was his therapist a couple years ago. He's wanted to work with me again, but he's in some Medicare Advantage plan. He swears that he didn't intend to change over, but now he's got this Advantage plan. He would like to inquire about getting switched back to original Medicare so he can work with me again. And so, longer story shorter, she comes back and just says, "Well, unfortunately, he's going to have to get through medical underwriting." We find out a couple of days later, he goes to medical underwriting. He got denied for something as basic as hypertension. Yeah. And I was like, wait a minute. The dude's like 78. I mean, find me a senior that doesn't have hypertension. And she said, that's our cause for denial for him to switch back to our supplement plan. And so that was when I realized, oh my gosh, like there are very rare cases where you can actually go back.
Yeah, exactly. Yeah. And I make sure to tell all of my clients that, hey, if you think that if you want to go Advantage, know that you have 6 months past your Part B effective date to enroll in your in a supplement, no underwriting. Yeah. If you wait to month 7 after that, they're going to look to underwrite you, and they're going to deny you for any possible reason that you can think of. I'm not saying you can't get it. If you're a sparkling beacon of health, I've had people who have gone through underwriting, and the underwriting process is different from carrier to carrier. Yep. But you pretty much have to be a sparkling beacon of health to get past the underwriting requirements and get issued the supplement. Correct. So it is much easier. Utilize that guaranteed issue period. Yeah. Avoid any and all underwriting where you can.
So stated differently, what typically my experience has been, you tell me if this is what you've seen too. Typically what you find is you got a 65 or 68-year-old who's like, I don't need to pay the additional cost for original Medicare because I'm healthy. I play pickleball 3 times a week with my wife. I haven't been to the doctor in 30 years. My ticker's good. My blood pressure's good. All that stuff's good. I don't have no signs of dementia. Like we vacation all the time. Why do I need to spend that kind of money on original Medicare with a supplement? I can save a couple $100 a month on just going with this Medicare Advantage plan. And then when the bad thing happens, now that's when you start to realize, holy smokes, I can't get back to this. And that was a big wake-up call for several of our patients because they had no idea that it was now closed off because of the medical underwriting thing. Yep. Yeah, there's actually legislation now. It's been, I think, a year or so ago, where they're trying to get the guaranteed issue to be nationwide. Right now, there are only 4 states. They're up in the Northeast. There's only 4 states that allow for guaranteed issue. And there's some strange wonkiness with that in the first place, but they do allow for guaranteed issue at least 1 time a year. There's one that's a little more than that, but 1 time a year you can switch back to original Medicare with a supplement without going through medical underwriting. And so it's funny. So the CBO, the Congressional Budget Office, does a whole analysis on this particular bill, and there's multiple things in this bill, but they kind of itemize what we think the cost impact is going to be for if we allow nationwide for it to be guaranteed issue for everybody. Because you think about it, remember, this is assuming that we have a Medicare Advantage plan or patient on a Medicare Advantage who's been healthy for the last 10 years, and now that emergencies happen, and now we're starting to see the decline. Now they need to flip back because we're going to assume the sicker ones are going to be the ones who are going to flip back to traditional Medicare, right? Mm-hmm. And so the CBO comes out and they say, we think it's going to cost $1.4 billion extra to Medicare over the next 10 years. If I'm quoting that wrong, I apologize, but I want to believe it because I don't have that stat in front of me. But it was actually a quite small number. So 1.4, it doesn't matter. It was 14 billion, it doesn't matter. It was 1.4 billion over the next 10 years. So it was like 140 million a year because of the increased cost to Medicare and what they thought would be the increased cost to a supplemental plan for that. And what's interesting is that the MedPAC, which is the Medicare Payment Advisory Committee, they come out and they look at everything. They look at hospital charges, they look at home health, they look at skilled nursing facilities, rehab, they look at Medicare Advantage, anything that touches Medicare dollars. They're kind of evaluating to see, are we doing a good job with taxpayer monies? Are we being efficient? Are we providing good quality care? Blah, 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 all these things. And so what they have found, and I think they're actually a little bit probably conservative because I've seen other studies too, they found that every year, Medicare Advantage plans cost Medicare $83 billion. So to go to guaranteed issue, it costs $1.4 billion over the next 10 years. Every year in its current format, we're spending $83 billion minimum, an overage cost to Medicare being on Medicare Advantage. And so that's one of those things they're starting to talk a lot more about now, which is why I wanted to have you on, because there's so much stuff that's come out now with, there's been some DOJ investigations into United Healthcare and that kind of stuff. And so I think anytime that there's federal dollars involved, there's just this there's a tendency to kind of want to use and abuse it. And I think, unfortunately, what the intention of the program was, because I was actually a fan of it 10 years ago, the intention of the program was, hey, the government has no business being in the insurance market. They have no idea how to manage doctors. They have no idea how to do authorizations. Like, why don't we just let the private insurance guys who've been doing this for the last 80 years, manage that, create some efficiencies, save the taxpayer dollars. And what now they are finding out, in fact, the guy who was the originator of Medicare Advantage, he actually co-wrote that bill to create the Medicare Advantage. He said they become a beast that we had no idea. Like, it is no longer what we thought they were going to be. And we need to completely either scrap it or revamp this whole thing. And so when the originating guys are coming out saying this, and now there's actually bipartisan support, which is really interesting because we talked before about usually bipartisan support is in favor of Medicare Advantage. Now you're seeing bipartisan support and going, this is wrong. This is broken. We need to fix this. And so my big thing is, I think you just fix it if you just make everything guaranteed issue, put them all on a level playing field. And that way you can go in and out, and it forces the Medicare Advantage plans to actually compete with original Medicare, the denials, that kind of stuff. So
it's like everything. Competition brings out the best.
Yeah, that's right. So I don't think we should get rid of them. Like, I'm not in favor of getting rid of them, but I do think you need to make sure that they compete well against an insurance product, if you will, like original Medicare, that does not have the denial issues that Medicare Advantage has and those things. Yeah.
And I think one of the things that they were going to start doing with the Advantage plans is, and I don't know where I heard this, I believe it was at a carrier training. And I don't know if it was this year or next year, but they're going to start implementing kind of like a mid-year review for their clients. Say, hey, look, you're on this plan. These are the benefits you have available to you. This is what you have not taken advantage of. If you're on an Advantage plan, you need to take advantage of them.
Yeah.
You get the most out of them. You need to, go get your teeth cleaned.
Do you know what's so funny about that? I have so many stats rolling in my head. It's the overwhelming majority. I'm going to quote like 80%. It could be 60%, but it's the majority because it's been a couple of years since I've seen the stat. But there was actually a study that looked at those fringe benefits, if you will. The transportation,
the extra stuff,
all the extra stuff.
By the way, no senior ever knows is part of their Medicare Advantage plan
somewhere in the neighborhood.
Them.
On the study I looked at, somewhere in the neighborhood that 60 to 80%. I want to say it was closer to the 80% because it was like eye popping. Like, whoa, that many people don't even access it. The majority of people who have those Medicare Advantage plans who have access to dental, vision, transportation aren't even using it. And so it's just like they looked at it as this like a little piggy bank for the insurance company to play with because nobody's using it.
Yeah, exactly.
So I appreciate them wanting to at least go, hey,
just a little bit of accountability there.
Yeah, no, I get to. That's cool. Okay. We talked the other night about a plan I had no idea about because I hear this all the time where it's like, my parents know they are forbidden for life. Don't you be calling my parents. They are forbidden for life to change off of Medicare with a supplement. I don't care if I have to pay for it for them. They are staying on it because I see it, what happens when you start to need healthcare. And so they'll stay on this forever. But I didn't know that there was an actual in between of I need the cost savings that Medicare Advantage provides me, but I also want the accessibility that Medicare provides me. And I've only ever been familiar with the A and the B, right? We talked about that before. And then some sort of an F or a G. Before we get to 2070, there's probably going to be a Z plan, but they keep adding these letters to it. So I only knew about F and G, and most of those plans are like a G, which is your typical supplement now. You were talking about an N plan last night, and I was like, I had no idea that this existed.
So what we can go back even a little bit further and talk about Plan F.
Please.
First. So Plan F was the golden child of Medicare supplements. It covered everything. It covered your Part B deductible. It was the most expensive. Plan Fs stopped being issued regularly to individuals who are Medicare or 2020, 2021. You can only get a Plan F if you're Medicare eligible prior to 2020. So what happened? The Plan F enrollees were costing the insurance companies too much money, essentially. So they started to restrict who can get on Plan F. Plan G took the place. Plan G is now the current golden child of the supplements.
What did they take away to make it less costly?
So on a Plan G, the difference between Plan G and Plan F covers your Part B deductible. Plan G does not.
Got it.
So you have a the insurance company's risk mitigation is that you having to pay the first $257 this year, whatever your Part B deductible is, you're gonna owe that on your Plan G.
Okay.
You can still get a Plan F if you're Medicare eligible before. The premiums don't justify it. You're better off getting a Plan G, paying your deductible. You're gonna come out ahead. What's gonna happen eventually? The same thing that happened with Plan F. All these Plan G enrollees are going to cost the insurance companies too much money, and in turn, they are going to restrict and get on a Plan G. Well, what's the next best plan? Currently, as it sits, it's Plan N. Plan N is in the market. It is gaining a lot of traction right now. Plan N, you're going to get the same coverage as you get with a Plan G. So same hospital coverage. You're still paying your Part B deductible every single year. On top of that, you have virtually 2 more copays. You have a $20 office copay to go see either your primary care doctor, go see a specialist, and then you have a $50 emergency room copay. The big holdup with the supplements is people are like, I'm already paying $185. I don't know if I want to pay an extra $150 for a Plan G. Yep. Plan N right now is about $30 to $40. I think I did the average earlier. It's about $42, give or take, depending on the company, less per month than your Plan G.
So it's a third less, essentially.
Essentially, yeah. So I think you'll end up saving approximately $500 per year being on an N versus Plan G. And I don't have the facts in front of me right now, but there are some preliminary studies being done that are going to suggest that you're actually going to come out ahead of the game on a Plan N, pocketing the extra $40 a month, paying your doctor every time you go see him. By the time you're 85, you're going to actually come out ahead and pay less on a Plan N than what you would have on a Plan G. So I personally think Plan Ns are going to start gaining a lot more traction in the market space in the not too near future, especially with everything else is getting more expensive, right? Plan Gs are no different. Plan Gs are increasing premium wise more quickly, more significantly than the Plan Ns are. And that's, I think, just because more people are on Plan Gs, more people are getting the healthcare.
Well, and if you, just from a human behavior standpoint, like somebody who avoided going to the hospital recently because of a cost thing. Yeah. And so if I have to consider a $50 ER cost, maybe I'm calling my PCP and waiting until tomorrow morning, or I'm utilizing an urgent care, house call practice. Like we have a couple of them here that we can call, they'll see up to 10 p.m. Yeah. And so maybe that also curbs some of that expense on Medicare too. And the patient gets to save money.
Yeah, exactly.
Yeah, I think it's huge.
And I think on top of that, I think the carriers are going to start pushing that. And it's already evident as a broker seeing the the extra incentives, the bonuses being offered for these two plans, they are not the same. A Plan G bonus is going to be maxed at about $50 per application. These insurance companies, they're willing to pay some companies up to $250 bonus for a plan N.
Yeah, that's all you have to do. Watch where the financial incentives are for the insurance company. They'll tell you exactly where their bread's buttered.
Exactly. They're going to tell you what they want.
I actually agree with the N because of the human behavior part of it, and for some people that $50 a month or ish is a huge game changer for them.
And you still have the protection. You don't necessarily have a max out of pocket per se because you're paying $20 every time you go see your doctor, but it's a lot more manageable than a 20% coinsurance. You do not have the risk of a claim denial with the Advantage plan. I think it's going to be a very attractive option. It's attractive to me right now, honestly, but I think it will definitely start gaining a lot more popularity in the not too distant future. It's a great kind of in the middle. You're not getting the full benefits of the Plan G. It's also not as expensive type thing. Yeah,
I was glad you mentioned that to me because I had never, of all the brokers I've talked to, I've never heard of. And do you know when it started?
As far as I know, it's been in the market as long as I have. So starting in 22 for sure. It's not talked about because, well, first of all, what commercials do you see on TV? You see the Advantage plan commercials. When was the last time you saw a supplement commercial?
Never.
And then on top of that, I mean, in the grand scheme of things, $150 for a Plan G supplement. When you take into account all the benefits that you get, it's not terrible. Like you can very easily justify it. For very similar coverage for $50 less per month, $40 less per month. I think the Plan N is
that's great.
Right there behind it.
I'm glad you mentioned that.
It's why people like you are so important, right? Because I've got, seniors who are trying to call or look on the CMS.gov, trying to navigate all of this. I mean, just you have a resource that you put in front of us with checkboxes. And it's easy when you start talking for me to see what's covered and what's not covered, but it looked like foreign language when you sat it in front of me before. So I think it's neat to have these navigators like yourself to help the seniors walk through all of this.
And I guess I'll toot my own horn real quick. It's important to me to be a good agent. It would be very easy for me to field a phone call, sell one plan that's going to line my pockets, hang up, and never talk to that person again. I don't believe in that. That's not how I would want to be treated. That's not how I would want my family to be treated. Yep. My job as an agent is to walk down the middle of the road, tell you the benefits and the cons for both Advantage plan, supplement, whatever it might be, and help you make the decision that's going to be best for you in the long run. That's now, that's 10 years from now, that's 20 years from now. Yep. It's my job to give you a picture of what you're going to be looking at. And most times people are very easily able to make their own decision. If they just absolutely can't, they see the benefits of both sides. At the end of the day, I say, do your supplement first. And if you absolutely hate it, you hate spending that extra money, you can try your Advantage plan. Yep. You might not be able to go Advantage plan to supplement if something else happens. So it's a lot easier to go one way as opposed to the other.
I'm hopeful we're going to see a legislation change on that. And Leslie, we were talking before, Medicare's a federal thing, but the guaranteed issue aspect is actually state. Mm-hmm. Now, Medicare can apply pressure to the states to actually do that because it's a insurance regulatory thing. One last thing before we go. Just yesterday, the Department of Health and Human Services announced that they have agreed, I guess in principle, I haven't seen. I see the fancy HHS.gov news release on there. It's a little bit scant on details, but essentially what they've done is they sat down with the heads of multiple of these large insurance companies, Medicare Advantage plans, and some Medicaid ones, and because they're concerned about the level of denials, which has increased 58%, I think, over the last 4 years, something like that. Because you've done the case management thing, and so they were concerned about that because they're hearing a lot of, like me, people bitching about it. They're getting phone calls from family members and seniors themselves, and so it's capturing a larger audience now. And so they did come out and say, hey, we've agreed in principle, at least, to reducing the denials. So they're going to carve out certain diagnoses and certain procedures from what I'm reading, including PT, which makes me happy because it's conservative treatment that will remove some of the denial issues. My concern about this is I love it and I think it's great, but there's also recent news on Aetna. I can do it because it was actually in the news. Aetna and Humana both discharged, if you will. We use the term discharge. They removed roughly 600,000 people off of their Medicare Advantage rolls last year because they're too costly. United Healthcare was all too excited to pick them up. and they paid for it dearly with their stock price because now they're realizing they're too costly. So my concern on while I like the reducing the denial thing, if we do reduce denials and those costs actually drive up, you're going to see more people like United Healthcare is going to do the same thing that CVS and Aetna did, which was like, we can't afford to keep these people on, so we'll pass you off to somebody else. Well, Aetna and Humana already dumped you. You're not going back over there. So that's my concern is, where does this go? Second and third order consequences if we start to push back too heavily on the denial thing. There
needs to be a happy medium somewhere.
Yeah.
Not everyone can be approved. Not everyone can be denied. There has to be some sort of give and take. Like,
dude, I could talk to you about this all day long. One final thing. Okay. I highly recommend for the folks listening to this. Don't call the 800 numbers when you see those mailers and when you see the commercials. Like, please make sure you're dealing with somebody who's local, who you can meet with. I totally appreciate where Brandon's coming from with the educational piece of it and just kind of being very logical and, hey, here's pros and cons, here's your trade-offs. You're not going to get that level of detail, I don't think, with an 800 place. It feels a little more like a bait and switch thing. When you may not know them.
What you're signing up for, which
I'm
is a lot of
the majority of the people who think they're still in Medicare,
right?
We're calling 800 numbers versus meeting with someone like Brandon. So please make sure. So how would they get in touch with you?
Yeah, absolutely. Well, first of all, we have an office here off of 75 and 635-ish, 7920 Beltline Road, Suite 520. I'll get you guys all of my contact info. Yep. Give me a call, give Ryan a call, shoot us an email. We go all over the Metroplex to meet our clients.
What's the best number for them to reach you?
972-467-8243.
And then email address?
Brandon at zifsmedicare.com. And that cell phone number, it goes directly to my cell phone. It's on me 24/7. If I don't answer, leave me a voicemail. My phone rings all hours of the day. Dealing with that, or not dealing with, I have the privilege of taking care of a 4-month-old baby at home.
I was going to say, you're probably up anyways, right?
Yeah, I'm going to be awake. So if I don't answer, it's probably because I'm either helping feed or doing something like that. But yes, we go all over the Metroplex. You're more than welcome to meet at our office. We can come to you, go to a Starbucks, have a nice lunch. We try to make it as easy as possible, whether it's just on the phone, Zoom call, or whatever it might be. Some people a little bit more old-fashioned, need to face-to-face, pen to paper. Absolutely, I get it. We will do whatever is necessary. So give me a call, shoot us an email. I'd rattle off Ryan's phone number, but I do not have it memorized. So I'm sorry, Ryan. So absolutely, awesome. Brian, it's been great.
Yeah.
As well.
Thanks, Brandon. Appreciate you.
Thank you very much.